we have to go through all the core principles or the behavior ABA therapy foundations. Okay. These are the learning outcomes. You have to read this slide very carefully that at the end of the episode 4 and episode 5, you will learn all of these things, inshallah. Okay, let's go for this one. This is the visual mind map of ABA foundations. Whenever the word ABA comes in your mind, these things you should know and you should remember. Okay, first of all, like behavior therapy, motivating operations, behavior therapist role, extinction, reinforcement, functions of behavior, stimulus control, and punishment all lead towards the ABA. Okay, so what does the ABA, what does like it brings to the table all of these things, what like foundations bring? Okay, so the thing is, in ABA foundations, all of these things bring a positive behavior change, and that change is evidence based, ethical, measurable behavioral change. It should be evidence based. Okay, it should be ethical, it should be measurable behavioral change. Okay, let's go and look at the what is behavior therapy. Okay, so let's go for this one. What is behavior therapy? Okay, whenever you go for viva or interview or any place in a child psychology, you have to define what is behavior, what is behavior therapy, what is ABA. You should know the difference between these three. Okay, so what is behavior? Anything a person does, you have to mention this, anything a person does that can be observed or reliably measured. It means it can be seen through naked eye. For example, hitting, you can see a boy is hitting. Okay, it can be observed, it can be observed by anybody. Or reliably measured, it means consistently, it can be measured, it has proper frequency, it has proper duration, each and everything. And it includes actions such as requesting, writing, uh, it includes writing, requesting, waiting, crying, hitting, reading, or following an instruction. Private events may be discussed, but intervention targets must be operationally defined. It means in the behavior, whenever I ask for behavior, these are the examples that I have mentioned in front of you. When I say when I say I'm hungry, hungry can be seen. When I say I'm tired, tired can't be seen. Okay, so anything that is action oriented, that can be performed by a person, that can be replicated, all of these are like behavior. Then you have to go and define the behavior therapy. What does mean by behavior therapy? A broad family of interventions. It means in a behavior therapy, there is a family of interventions. Behavior therapy is not a name of one thing. It is a family of interventions that uses learning principles to reduce distress. One thing I want to like ask you guys, have you seen anybody coming to the clinic or institute just because their child is so good academically, he's so good, adaptive functioning, executive functioning, all of these are so good? No. Why will somebody is like coming to you? He or she will come because the behavior of the child is affecting them negatively. They are getting distressed, they are getting disturbed, their environment is getting affected because of that behavior of a child. So you have to reduce that distress, you have to teach the coping strength, adaptive behavior, and improve functioning. For example, exposure, skills training, reinforcement, self-management, and parent coaching. And remember that in parent coaching, parental training, parent guidance, each and everything is very important. And then let's go for the applied behavior analysis. In applied behavior analysis, a science is totally focused on socially significant behavior and the environmental variables that influence it. I have mentioned it multiple times that we are social animals. Okay, so we have to look very carefully about the socially significant behaviors that any complaint, any presenting complaints, we have to work that The behavior should be socially significantly appropriate, and it should be according to the environmental demands, because environment does affect. Okay, so you have to look at this, that how the environmental variable is affecting the behavior and how can we manage that. Okay, so applied behavior analysis, when you guys will do the IBT or IB or something, you guys will know there are like four main domains of related to behavior therapy or behavior degree. So applied behavior analysis is one of them. ABA uses direct measurement, systematic analysis, function-based intervention, and ongoing data-based decision making. Okay, these are the 7 dimensions of ABM. You should know this, you should remember this, and when I take the quiz of you guys, remember that you should know this on your fingertips. That what does mean by ABA? What are the 7 dimensions of ABA? Why, like, if somebody is coming to the ABA, okay, what he or she ex is expecting. If you are going to the ABA, being a therapist, what should be in your mind that what I'm going to go deal with? Okay, so ABA is applied. Okay, one dimension is applied, first dimension is applied. Then in ABA therapy, we include those targets, we include those goals which are important to the learner and the family. For example, if a child is coming and presenting complaint and he hits a lot, he cries a lot, I can't add the tracing out of nowhere. I have to work on hitting, crying. Okay, so that's important. And then there is a behavioral. Of course, in ABA, you will work on the things that can be seen, that can be actionally performed. Then you have to look at the analysis, analytic. It demonstrates a believable relationship between intervention and change. I have told you that there is always a relationship between intervention and change. If you are like bringing one intervention, for example, there is a target of increasing eye contact of a child, and your intervention is that whenever I bring the reinforcement near to my eyes, the child will like trap the reinforcer and look into my eyes. That is an intervention, and the change is either his or her eye contact is increasing or not. So is there any relationship between these two things or not? Then there's a technological. Procedures are clear enough for another trained person to replicate. The replication is too much important. For example, I'm saying through the reinforcer, the eye contact can be increased. It should be like valid enough that it can be replicated by another trainer and other therapist. Then there's the conceptually systematic. Procedures are linked to behavioral principles. Any procedure, any intervention you apply in ABA, it should be totally based on behavioral principle. Don't just go for like I liked it or I have seen it, I have read about it. No, your procedure should be totally linked to behavioral principles. And then there's effective, produces meaningful improvement, not only statistical change. Any therapy, okay, any intervention in the ABA, if you are applying, you should know that it will bring a positive improvement, it will bring a meaningful improvement. Okay, we are not just presenting the interventions just for the graphical presentation or like the trend should be increased or decreased. No, we want a proper meaningful change in the child, positive change. And then there's a generality, and please remember that in ABA, you have to work a lot on generalization. First, we go for one-on-one, naturalistic intervention, and generalization. Okay. For example, I am teaching a child, what is your name? And she says, my name is Amna, for example. He or the girl is telling me only, what is your name? My name is Amna. I have to send the girl to another therapist, to another therapy room, so that it can be generalized. Okay. And then there's the ABC contingency. You have to look at this very carefully. It's very, very important, the ABC contingency. What does the A, B, and C means? I'm going to tell you guys one very important thing. in this ABC contingencies, you have to note it down. Okay. Antecedent is immediately before the behavior. Okay. It's immediately before the behavior. These are the three terms you should know. Immediately, like within the 3 seconds before the behavior. The behavior is precisely defined action, the exact action that happened. And then there are the consequences immediately after the behavior. Okay. I told you that I'm going to tell you one thing, that consequences are what the therapist is doing after the behavior, what the caretaker, what the parent is doing after the behavior. Okay, as you guys know that behavior is like increased or decreased based on the consequences. Consequences, but like who is giving the consequences? The like therapist or parents are giving the consequences. For example, there are antecedents, multiple antecedents, you can grade this. Then there's the behavior, multiple behaviors a child can present, and then there are the consequences. Like for example, there's a child, recently I was taking session of her, and she was like asking or requesting multiple times to go on a trampoline. I denied. Okay. The antecedent was I denied the trampoline access. Behavior was she started to cry. She started to scream. And what are the consequences? There would be two possible consequences. One is, okay, let's go to the trampoline. And the other is, I diverted the attention of the child. I like gave another task. Okay, these are the consequences. When I say, okay, go ahead, go to the trampoline because of just crying, of course, her crying behavior will increase. That because of crying, I get access. Okay, so these are the consequences. You have to deal accordingly, be very careful, and it's your homework assignment number 3, task number 1, that you have to make a list of possible antecedent, possible behaviors, and possible consequences. This is the example. I have already given you one example. You can look at this very carefully. And this is one, for example, if a child is presenting the same behavior for 3, 4, 5 days, I have to keep the data record on the ABC data sheet. Okay. If you need, then I can send you in a group. You can just type in the comment that you need that ABC data sheet. I will send you guys. Okay, and it's also your homework. Okay, you have to at least collect 5 ABC observations from one child across 2 settings. Okay, and then there's the homework is sanctioned. You can read it. But let me tell you guys that what will you do? You will have 5 behaviors, 5 antecedents, 5 consequences, and okay, you can read this that the ABC data sheet. How does the ABC data sheet look? First of all, you have to note the time. You can note the day. You can note the like um, date, and then you have to write the behavior. What was the behavior of the child? Exactly what happened within the 3 or 5 or 10 seconds. What did happen? Why did the child do this? And then you have to write the consequences. How you dealt with that? Okay, and then there are the possible functions. There are actually 4 possible functions, and you can't write it randomly here until unless you have practiced it. But first write it for your homework as you think that it can be possible. And if somebody doesn't have any child, it's okay, it's totally normal. Behavior therapy is not only related to the children. You can notice it for any adolescent, an adult, or anybody. Just for like teaching you guys, this is your task number 2. Okay, let's go for the role of behavior therapist. It's very important that you understand that if you are getting hired being a behavior therapist, what are your professional boundaries? What are your responsibilities? How are you going to do the teamwork? How are you going to collect data and your ethical conduct? Okay. So what does a behavior therapist do? Okay. So these are the 3 things. One thing I want to make it sure that in Pakistan there is still lack of malpractice, or you can say that we are just growing in the field. Okay, so one thing is, we being behavior analysts make the plan of the children. Okay, and it's the duty of the therapist to implement that plan. For the plan implementation, you have to go through the program that is designed or approved by a qualified supervisor. Most of the time in our clinical settings, as I've seen in around the multiple cities, that therapists are like dealing with the child by themselves, and they have to implement, they have to plan, they have to design. Each and everything is getting done by the behavior therapist, but actually in reality it's not the duty of a therapist, it's the duty of a behavior analyst. Okay, so you have to look at the plan given to you for a child. Then you have to go for the data collection. You have to record accurate, timely, objective data. And one thing I want to tell you guys, that most of the time it's the 1 hour session of behavior therapy, and out of 1 hour we conduct the session for 45 minutes, and the last 15 minutes are for the data, so that you can daily record the data. You have authentic resource, you have authentic like proof of everything, and you don't need to change the result. One thing I want to tell you guys, don't change the result of the children. It's not your assessment. I have seen some children, some therapists like this. Please, it's not your assessment, it's the assessment of the children, it's the record of the like child. Why are you like making it socially desirable? No, keep it authentic. And then you have to teach skills. I will tell you guys about how we do the prompting, reinforcement, shaping, chaining, DTT, anity, generalization. Okay. And then it's the supports behavior. How do you like implement the strategies, how you communicate with the supervisor, with families. You have to, of course, deal with them with your boundaries, within your boundaries. And then you have to also protect your dignity. And you must do and you not do. These are the things you can read it very carefully, that if I'm getting hired as a behavior therapist, these are my duties within a role and these are outside my role. Okay, within role is you have to implement approved goal and procedures, collect data, prepare materials, report side effects, seek clarification, follow safeguard procedures, maintain confidentiality, participate in supervision, support caregiver practice as unauthorized, and outside is diagnosed independently. You being behavior therapist can't give the diagnosis. Okay, you can't change the behavior plan without the approval. The analyst has looked up at something. That's why they are like adding or like removing some tasks. Then there are multiple things. Accept share client media. No, you can't share the client media. You can't share the pictures without the consent in each and everything. Because I have seen one unethical practice, that on Snapchat, multiple therapists while taking sessions share the snaps of a session with the proper picture of the child. Don't accept any dual relationship with the attendance of the children, with other colleagues and all. Practice beyond competence. No, don't go for that until unless you are trained for anything, or you don't need to hide errors or falsify data. And this is how a high quality therapy session look like. So you have to, first of all, before you have to review targets, you have to review data. Is the material available or not? Have you identified the preferences of the child or not? What are the reinforcers you should know? And then go for the pairing. Of course, you have to build a rapport building. You have to like go for rapport building with a child, properly have an emotional connection with a child, and then you have to teach. After teaching, you have to go to observe that is my like strategies, are my strategies working or not. Then you have to observe and record the data and debrief. Okay, what does the data quality, treatment integrity, and the clinical judgment? Data quality, how, like you are going to record the data, how should it look like? Operationally, definitions are clear. Recording begins and ends at the planned times. Missed opportunities are documented. For example, you did not take a session or you did not perform a task. You should mention that. You have to count the frequency of a behavior. For example, a child is here and he or she is throwing a pencil multiple times. You have to notice that he threw a pencil 5 times, okay, in a 30-minute session. You should rate it properly. And duration, latency, interval, trial by trial. I will teach you guys what does, like, how do we collect the data and what does it mean, how do we record it, okay, what does trial by trial and permanent product. It will be in like sent to you guys inshallah in the coming episodes. And treatment integrity, it means be honest, okay, be honest to your duty, be honest, like, have you like worked accordingly according to your knowledge? Do you think it's going to be best or not? Are you delivering the reinforcement quickly or not? And then there are the decision rules. Working with families and schools and multilingual context is very important. You should know that being a behavior therapist, you have to go to a lot of things. Okay, first of all, when child comes to you, you should like ask the parents about the child, the language, uh, child language. What is the preference of the parents for the language? Okay, then, being Pakistani, many families are living in joint families, and joint families affect multiple times, both in negative and positive way. So you have to identify that. Then you have to go for the affordable and available reinforcers. Don't just ask parents to buy the fancy and like expensive. No, they are already going through a lot of things. So please use most of the time the most reasonable, the most like easy or convenient to them. And then you have to coordinate with the teachers when possible, because many students also go to schools side by side. And then you have to explain the behavioral terms in parent friendly language. Don't try to be too over professional in front of parents, because what, like, how will you look being a behavior therapist if parents are not getting properly informed? They are not getting understood because of you and your language. How will they like work on the child if they are not getting your points? Okay, so you have to, and then you have to plan the generalization. Whenever you task assign a task, you have to properly ask the mothers or the parents that please generalize it across the sibling, grandparents, domestic routines, community visits, and school demands. And this is a very important topic, reinforcement and punishment. I have told you guys about the consequences as they are defined by their future effects on the behavior, not by intention. These are the 4 consequences terms I want to tell you guys in behavior therapy. Okay, in behavior therapy, positive doesn't mean that you will get happy, and negative doesn't mean you will not get happy. Okay, positive and negative doesn't mean the same in the behavior therapy. In behavior therapy, positive means you are adding a stimulus, and in negative it means you are removing a stimulus. And when you are going to understand the reinforcement and punishment, please note down these 2 points. And this is a task number 3, that what do we focus while teaching reinforcement, while using this intervention of reinforcement and punishment. Task number 3 is, there are 2 terms, stimulus and response. Okay, stimulus or behavior. Stimulus is anything or behavior is the response. You have to maybe add a stimulus or remove a stimulus, and accordingly the behavior will increase or decrease, because many people get confused with the negative reinforcement with the punishment and all of that. In positive, you add something, something valuable, something desirable, reinforcement, that's why the behavior increases. In negative reinforcement, he removes something undesirable and the behavior increases. For example, there's an example, a child asks for break, difficult task pauses, appropriate break requested increases. In this, what did we remove? Like in negative, we said we remove things. And in reinforcement, we say something get increased. Okay, the behavior will increase in reinforcement. So what will increase in this? First is the child asked for break. He or she requested. Okay. What did you remove? You removed difficult task. And what did the increase? Which behavior increased? Requested increased. Okay. And then is the positive punishment. You add something undesirable, so the behavior decreases. And in negative, you remove something desirable and the punishment. It's a behavior decreases. Okay. So let's go for this one, the reinforcement types, subtypes, and practical examples. We will come back to this, but first let's go for this one. There are types of reinforcer. There are like conditioned and unconditioned reinforcer, and then there are four different. For any unconditioned reinforcer, for example, food, warmth, sleep, these are unconditioned reinforcer. They don't have any specific learning history. Okay. And then there is a condition. It has a proper learning, it has a proper pairing, it has a proper learning history. And then these are the conditioned reinforcer. And then let's go for the social activity, tangible and sensory reinforcer. What are the social reinforcer? For example, some child is here. There are some children who like to get hug, who want to shake hands, who want to say high five, good job. They love this. And then there's activities. Maybe there are children who want to play football, being a reinforcer. They are tangible. For example, they love the ice cream, they love the coconut or cocoa or something like that, any tangible car or anything. And then there is a sensory, because there are multiple times children do like the sensory reinforcer. They demand for the sensory reinforcer. There's a proper sensory diet we have planned for that, like massages or something. And then how we make the reinforcement fully effective. For making the reinforcement fully effective, we have to look at this, that it should be immediate. Like, let me tell you guys that multiple times parents comes to us and they say, we are working the same way as you are doing, but still there are like multiple errors in the reinforcement procedure. It should be immediate. Like after the target, within 3 seconds, you should put the reinforcer on the table. Okay. And then there is contingent. Make clear which response produce the outcome. For example, I have a target of a child. Okay, do this, do the puzzle. The puzzle was done, and then there's a waiting. Okay, then I'm giving the reinforcer. Okay, what do you are you getting it? That which behavior was reinforced? Was the waiting reinforced or was the puzzle reinforced? So it's not clear, no? So you have to look at this, that make clear which response produce the outcome. And then it should be valuable. Use current preference as motivation, not adult assumption. For example, chocolate. Any child is here going to love chocolate. It's my assumption. It's not a reality. Many children don't like ice cream. Many children are here who don't like chocolate. So you have to look at this, that what is the current preference of the child, because preferences get changed with the passage of time. Then there's a proportional match amount and quality to response after and goals. It doesn't mean that after the waiting of 10 seconds, I'm giving the reinforcer for 2 minutes. No, please match amount and quality. Was the task difficult enough or not? You have to stay very proportional for that. And then there is varied. Please have a bucket of proper reinforcers, 6 to 7 for taking one session, and it should be varied. Go for the proper preference assessment. You have to look at the levels of the reinforcer, that which one is the most favorite of the child, and then less, then less, and then less. Okay. And please rotate options so that we can reduce the satiation. Then there is pairing, pair social praise and interaction with other reinforcer. Of course, being human, being social animal, we have to increase the social interaction. Then there is with passage of time, reduce the amount of the time the reinforcer is presented. Maximum a reinforcer should be presented for 30 seconds. Okay, and then let's go for the monitoring. Use data to confirm that target behavior increases without harmful side effects. And then it is this one that there are 4 reinforcement schedules. Uh, One is CRF, and the other is like intermittent. CRF is continuous. In continuous reinforcement schedule, after every single response, correct response, we are going to give the reinforcer at the very start of the session. When the child comes to you, we apply this one, that after every single task, we are going to present the reinforcer. It is also called as FR1. Then is the fixed ratio and variable ratio, fixed interval and variable interval. In ratio, we go for the number. In interval, we go for the time. In fixed ratio, it is simple, means how much number are required for the responses. For example, after every 3 correct responses, the behavior will be reinforced. Okay. And then there's a variable ratio, reinforcement after a varying amount. Like it's not fixed that it will be reinforced after every 2 tasks, after every 3 tasks. It's varied. It can be 3, it can be 4, it's just average number. And then there's interval schedule, fixed interval, variable interval, like after every 2 minutes, the behavior, like the reinforcer will be given, or it can be also variable, that no, it can be after 5 minutes, can be after 10 minutes, or something like that. Okay. And okay, let's go for this one. The preference is not the same as the reinforcement. Okay, so you have to look at what does the reinforcement mean. Reinforcer is the one who will increase the desired behavior. Okay, preference is something different. You have to go for the preference assessment, like first of all, for identifying the preference of the child, you have to conduct a caregiver interview. What is the choice of the child? Free operant observation, just observe the child in a session, and then go like what the learner approaches, engages, or request, okay, at the start of the session. And then is the structured assessment. There's a proper questionnaires, proper tools, proper like you can see a documented form of assessments. It is single stimulus, pair, multiple stimulus with replacement or without replacement. And then we go for the reinforcement assessment. Test whether excess or contingency on a response increases that response compared with a control condition. Only behavioral change confirms reinforcement. It means that, for example, the heating. No. Okay, let's go for the one. For example, I am teaching a child a tracing. Okay. Whenever there are 2 conditions, control and the experimental. One is that whenever the child traces the horizontal line, I give a reinforcer. The tracing is getting increased. And on other way, on other scene, whenever the child traces the horizontal line, I'm not giving a reinforcer. Okay. So is the tracing getting increased or not? You have to assess this. Okay. These are the examples you have to look. Like choices may include bubbles, drawing, mobile game, cricket, swing, chips, sticker, music, sensory play, or social games. You can give these options. And let's get back to this one. These are the reinforcement types: positive reinforcement, negative reinforcement, natural reinforcement, contrived reinforcement, primary reinforcement, and secondary reinforcement. Reinforcement is very important topic, so we have to discuss a lot for this. Reinforcement always means the behavior increases in the future because of what happened after it. Okay. In positive, a stimulus is added after the behavior and the behavior increases. In negative reinforcement, an aversive stimulus is removed after the behavior. Okay, the behavior was, as I told you guys, the behavior was requesting break, and the aversive stimulus was homework assignment. We removed that. Okay, so the requesting got increased. Reinforcer occurs naturally in the environment. It's a natural reinforcement. And contrived reinforcement, reinforcer is arranged by a therapist. Okay. So we have to make some reinforcers more like attractive to some children, because there are multiple times there are few children who don't like at all anything, and they don't get stuck at one reinforcer. They want like another reinforcer early morning every another day. Then there's a primary reinforcer, biologically important. Okay. Then there's the secondary reinforcers, which are condition reinforcers, where learn values by pairing with other reinforcer. For example, token board, praise, star stamp, excellent job, etc. This is the reinforcement topic. And let's go for this one, the punishment. Punishment is the one which decreases the future behavior. Okay, so you have to look at this. It's going to decrease the future behavior, not by anger or harshness, but because of the consequences he or she had to face after the behavior. A consequences follows our response and decreases the future probability of that response under similar conditions. Positive and negative describe adding or removing a stimulus, not good or bad. Caution, why caution is important? Because punishment, we go for the punishment at the very last stages. We don't go or run to the punishment at the very start of the behavior therapy. Maybe it will develop the fear, avoidance, aggression, emotional responding, modeling of person, suppression without skill teaching, damage, rapport, and dependence on the punishment agent. You have to stay very careful while introducing the punishment. And then there is ethical priorities. You have to be like very well informed. How can we give the punishment to the child? What are the ethical boundaries for this? Okay, it should require competency, consent, oversight, clear criteria, monitoring, and the least restrictive effective option. Okay, and then there are subtypes for it. Um, Positive, negative response, cause, timeout, and overcorrection. For positive punishment, of course, you will add something undesirable, and there is negative punishment. You will remove something desirable. Okay. Then there's the response cost, specific type of negative punishment. And then a response cost, it means just look at this. For example, person has to pay fine over red signal, over speeding after clear rules are taught. But it means the rules were clearly taught to that person, but still what he did over speeding. He crossed the red signals, so he had to pay a cost for that response, for that behavior. Try to understand response cost accordingly. And then there's a timeout. For example, you may have seen that in our childhood, when we didn't learn the lesson, and the teacher was used to say, "Okay, go out of my class. Go at the end of the class. Just stand up." That is a timeout. It means the temporary removal from access to reinforcement. And then there's the overcorrection. Learner restores environment and practices correct response. It, for example, there is a child who throws a lot of things. For example, I have put a puzzle. I have put a single inside board in front of him, and he or she, what will do? He will throw all the things in the therapy room. What I will do for the overcorrection, I will say just pick up all the things and any other thing related to that to clean up, so that his behavior of throwing gets decreased. And you have to look at the common reinforcement and punishment confusion. It is your task. You have to read it and ask any question related to it. That if you have still any confusion in reinforcement and punishment. And the task number 4 is you have to write a proper difference in reinforcement and punishment. What is the difference between these two? What are their subtypes, and how are you going to generalize that? How, like, you have to write five examples for each in the daily living examples. Okay. Okay, let's wind it up. This was the episode 4, and see you soon for the coming lecture in the episode 5. I love it, everybody.